What a great program to have on a Monday. We're going to be talking about gratitude, grounding, and grit. And boy, do we live in a time where we could utilize this conversation. We have a great program today. We actually have two presenters today. But before we get into that, I want to invite you to open up your chat box. I will explain a little bit about how we're going to be doing today's format, but we do want you to ask your questions to the chat. And of course, give us a shout out. Thanks to Ken, who's kicking us off from rural Oregon. So good to have all of you joining us. My name is Anissa Mitchell with PMD Alliance. And today we have the pleasure of Dr. Mindy Bixby, who's a movement disorder specialist in Southern California. She has a practice in California in ocean neurology in Laguna Beach. And then I think she has a new project that she's going to share with us today. Many of you know Dr. Bixby. She's been on our programs before. She is one of our partners, and we've been working with Dr. Bixby for years. She is going to share with you some insights about gratitude and grounding. And then with us also is Diana Christensen, who's going to be sharing a couple of things, but I know part of that is going to include some breath work. And she has a master's in psychology, and she also is trained in yoga, breath, and meditation with master teachers from India and in India, which is just fascinating, and has been doing this work for over 25 years. So we're in for a huge treat today. So I am going to pass this over to start with Dr. Bixby. She's going to share some slides with you all. Then we're going to take a few questions, and then we're going to do our work with Diana. So I'm going to pass this over to you, Dr. Bixby.
Wonderful. Hi, everyone. Thank you so much for coming and joining us today all across the United States. I feel so grateful for being here. It was not perfect to say that when we first start out. I am a movement disorder specialist. I completed my training at Georgetown and then ultimately found my way back to the West Coast to practice wonderful opportunity to practice movement disorders in this area. And so we're going to get the presentation started. Today we are talking about grounding, gratitude, and grit. Do you want to open it up for me, Kelly? Thank you so much. And here we go. So today, this project of mine has been slowly building over time, and this wonderful opportunity of a lecture is actually dedicated to all of you and all of you that know me. To have gratitude, grounding, and grit, you have to feel that you're surrounded by people that allow you to have that as well. So I want to thank you all that are listening, that know me, to be here today and also have an opportunity to talk a little bit more about these wonderful 3 Gs in the road ahead. So next slide, please. So let's talk about the talk overview. We're going to actually give you some definitions of gratitude, grounding, and grit. We're also going to have this wonderful human being to join us. Her name is Diana Christensen, and she's been a part of my life for some time, and she's my mentor, my friend, and also my colleague. And I'll tell you all about her soon, but she will be helping us a little bit at the end of this talk move forward in the things that we learned today. Next slide. So what is gratitude? I mean, many of us and all of us probably know what gratitude is and how to be grateful, but let's talk about the definition. So definition, the quality of being thankful, readiness to show appreciation for love and return kindness. And so moving forward, looking around us and thinking about the people that surround us and the people that have given us opportunities to build ourselves up and allow us to go forward in life, are the people that we're grateful for. And we're grateful for the air in our lungs and the opportunities for us to feel not alone in a place where I know in the last 2.5 years, some of us may have felt that way, but be able to walk around and see, hey, you know what? This is my one beautiful, amazing life. And how has that been accomplished right now, today? To be grateful for that is the most amazing thing in the world. I mean, Diana taught me a wonderful way of doing this. And every morning I wake up and I use the 5 fingers of gratitude, but ultimately I put it over my heart and I said, okay, these are the 5 things I'm grateful for. And the idea is that one, it makes you feel and it stimulates so much in your body, which we'll talk about what it does for you and your soul, your mind, and your body. But the 5 things every day, the pinky has to be a little bit different, a different gratitude moment. And it ultimately helps me really dig deep into myself and allow me to start my day in the right way. Next paragraph. Next slide, please. So we all have a story to tell. Every single one of us has been through different things in our life that has shaped us to who we are. And I really love these 2 slide pictures. One is my daughter's class, actually, and they were supposed to actually give them the best shout out for gratitude in that picture. And ultimately imagining, my daughter's the one on the left lower, sitting there with her hands on her knees. But where do we go from there to the 5th grade class to ultimately on the lower right is all my friends that have Parkinson's that we actually had an opportunity to walk together, and what a feeling that was. And so imagine yourself asking yourself what you do on a regular basis. And the beauty of it is that, we have a voice, we also have a body, and we actually have an opportunity to actually build ourselves forward in life. And being grateful is so much more than happiness. And we'll talk a little bit more about that next slide. So what's happening? What's happening inside the brain when you have gratitude? Well, we now know that all these spaces are ultimately lighting up when you have gratitude. The beauty of it with fMRI and where we are now with understanding our brains and what's happening inside the brain when we do have gratitude. There's been so many studies across the nation over the last 15 years. It's incredible, and across the world, of looking at what happens to our brain when we have gratitude. And what it has been shown is that ultimately it helps you build yourself up. It allows you to have more judgment, opportunity for cognition, building that brain and that short-term memory, that long-term memory, and it also gives you an opportunity to actually feel good in a different way than you would when you're happy. Gratitude is ultimately giving you an opportunity to build forward and pay it forward. And ultimately, they have shown that actually makes you feel better and actually use more of your brain when you're having gratitude, even when you're just happy. It's great having smiles, but boy, do I love to give forward, because it makes all the difference in the world when I lay my head down to rest the next day. And I'm sure you understand that as well. Next slide. So they have found that there are some areas of the brain that ultimately, when you're using gratitude, are much more hyperactive, which is a great thing. And so we know that when you're using gratitude, you ultimately use 3 neurotransmitters. The 3 main neurotransmitters are dopamine, which we all know a lot about, serotonin, and norepinephrine. And so if you look at the slide, it says VTA, ventral tegmentum associative area, which is in the brainstem. And that area ultimately is the center of the moment of it, pushes us through. It's in the midbrain. And right above that is the basal ganglia. All of us know about that because that's where Parkinson's is related to, and that's where dopamine is made. And ultimately what it does is constantly stimulate that area. Guess what? We all need more dopamine. And so if we're able to do that by having gratitude, it creates all these beautiful cascades of events and all these signaling processes that allow you to actually have a boost of dopamine and serotonin and norepinephrine. We'll talk a little bit more about the neurotransmitters a little bit later, but it was actually found that all of these areas have been hyperactive when people have gratitude in their life. Next slide. So benefits of gratitude. Oh my goodness, there's so many, but we'll pick a couple, okay? So the first thing is what do you want to do? You want to be as healthy as possible. So the nice thing about gratitude is when they evaluated people's vital signs and how when they are actually looking at things and doing things that give you and push through gratitude, you lower your blood pressure and your stress hormone cortisol, which we'll talk a lot about today. And ultimately the whole goal is to keep that cortisol low so you can feel good and not feel stressed. What it also does is actually boost your immune system and your energy levels. They have found that ultimately it can nurture your self-esteem, ability to actually feel like you can move forward in your life no matter what's happening. The gratitude model, or ultimately a mechanism on a regular basis, can actually really build you up in a lot of different ways. And so let's talk about how we can actually use gratitude in our life. Next slide. So 5 ways to practice gratitude. These are just 5. There's a million of them, but I like the 5 these days because here I am with my gratitude on my heart every day. So let's talk. So the first one is think. Think of 5 things that you're most grateful for on a daily basis. Visualize them. think about them, detail them. It ultimately gives you an opportunity to have a picture in your life of what you're grateful for, and ultimately give you an opportunity every single morning to wake up in a really good light. Start a gratitude journal. Journaling has been shown to be great therapy for anything that's happening in your life. And I've looked back at some of my journals, and it's amazing how much I've grown over the period of such a short period of time, even over the last 2 years. And so gratitude journals really help you kind of build yourself through whatever's happening in your life, whether it's harder or more wonderful or whatever's happening. Gives you an opportunity to say, hey, you know, I did not get here by myself. I mean, I have had so many wonderful people that have helped me move forward with the idea of what I wanted in my life. And the beauty of it is that I'm grateful for every single moment and every one of you that is listening today. I'm already feeling wonderful. I already feel that feeling of gratitude because I have it for all of you. Thank someone every week. I say every day or every moment, but if you can thank someone every week, I think that will really help you. Focus on the good things. Again, I know that sometimes things are hard, but sometimes if you can just give yourself a moment to say, what is good in my life? Even if it's really hard today, it helps you kind of get out of that situation and stop that feedback loop sometimes that we have that is self-doubt or things that we worry about that ultimately maybe never happen. My mother always told me that about 95% of the things that we worry about never happen. And it's a wasted emotion. So why don't we just push forward and go, okay, what can I think about that's going to keep me off of that track and get me to a better space? Consider a happiness jar, which we'll talk a little bit about next. So this is one of my favorite things that I do with my daughter. Next slide. The happiness jar. Ooh, if Lori Cook is listening to me, I'm there. Big hug for you. The happiness jar is something that is really, really important to my family's life. And I wanted to share it with you. What is it? It's ultimately an opportunity. And so I don't know if you do this, but I certainly do. On New Year's Eve, I said, wow, how did this day go by so fast? How does this year go by so fast? I don't even know what happened. And what we do in our house is we actually write down things that happened in our daily lives that made us happy. And so every day my daughter's like, hey, I have something happy that happened today. And we write a little thing down and we put it in the happiness jar. And at the end of the year, oh my goodness, we have so much in there. And then on New Year's Eve, we're able to actually sit down, ground ourselves and say, okay, let's look and see what happened today. Because here in California, we don't have a whole lot of seasons. And so I used to say, oh, it's snowing, and this is what happened, and this is what's going on. And I remember that day. But here in California, it's kind of sometimes feels like Groundhog Day. I'm not complaining, but it's nice to have those be able to say, hey, today I got to talk to you. This is going to be my happiness jar moment today, is that I'm going to be able to read this moment today and look back and remember. And it allows us to actually give us an opportunity of a pause on New Year's Eve. It also gives us an opportunity to remember how incredible our life is. So I think it's important. Just a thought. Next slide. So empowering the spirit, what is your vision? So I was taught about 15 years ago about something called wet penning. And wet penning is ultimately just taking a piece of paper and a pen and writing out perhaps a day in your life that's a little bit further away. Let's say it's 2023. And you envision your life of what it will be like. And every detail is important. So the year is 2023. My daughter is in 7th grade. She's thriving. She's doing great. I'm as healthy as I've ever been in my life. And I have an opportunity to be able to talk to people across the world. And I'm able to help people the way I've always wanted to. And I'm sitting in a chair of this color and everything else. And detail is so important. If you have a vision, if you know where you're going, you will get there. But if you don't know, or you don't have an idea, it's a little bit harder to get there. So what is your vision? And that's what I talk about a lot when it comes to understanding moving forward in our lives. I mean, no matter where you are in your life, if you prepare for it, it will happen. And that's the beauty of goals and taking steps towards it every single day. This will bring you a challenge to overcome moments of uncertainty in the future, but also knowing that, hey, I'm going one more step forward. And I think it's really important to empower your spirit. Next slide. The list. Okay, so let's talk about things you can do to get yourself gratitude. So ultimately, we want to build our bodies up and our minds up to be able to get to a place where we're walking forward in the best possible way. We don't have any regrets because today's our first day of the rest of our life, right? And so ultimately getting into a place of having a regular routine. A lot of you know, I talk about exercise on a regular basis, move the best you can with what you can do, get the daily exercise on a regular basis, having a regular routine. I wake up, I do this and this and this. Hey, I woke up, I had some coffee or tea. I've already accomplished something today. Count your blessings. We talked about gratitude. Eat healthy. We talk a lot. We have lots of talks actually, and hopefully to do one again soon about a healthy eating lifestyle and what you can do to move yourself forward in the most healthy light. We now know that processed foods are really hard on us. It can actually create a mood change and ultimately how our body is actually feeling on a regular basis. We talk about eating the rainbow and how important it is to actually have naturally unprocessed foods in your life. Water, 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 water. I talk about all the time and how important that is to actually keep your body in flow. Your brain's about 73% water. We need to keep that moving in a good way because ultimately if this is dehydrated, everything will feel dehydrated. Find ways to be creative, learn something new on a regular basis. It actually helps us stimulate so many brain areas to actually keep you in a good light in regard to cognition and thought processes and memory. Meditate, contemplate, slow your mind down. So find your ways, even if it's just 10 minutes a day to give you an opportunity. I know Diana's going to talk quite a bit about this, is kind of slow yourself in and give yourself a daily practice of gratitude. I think it's really important if we can get to that place that you already did that in the morning. And so you can move forward in a really good light. Love what needs loving, whatever that is, whether it be a puppy, a child, a love, and just give a hug. If any of you have known me, I'm a hugger. So ultimately giving an opportunity to actually say, okay, you know what, I'm embracing you for this beautiful day that we're both in right now. So ultimately that's what my goal is, to build that and spread love as much as I can and allow joy and laughter. We actually have a laughter club in Laguna Beach, and you can be a part of it, and all they do is laugh, and it's really wonderful and tell jokes. And so I actually just watched a wonderful parade, and they were part of the parade, and they would walk and they would just laugh and make everybody laugh. It was amazing how much it stimulated happiness as they walked by through the wonderful moment of time. And it's been around for about 25 years. It's pretty incredible. Next slide. So what is grounding? So I'm sure a lot of you know, feet right on the ground, feeling solid within yourself. And we talk about that a lot in our movement disorder practices, is how can I keep you safe when you're walking down on your feet throughout your life, and thinking like your feet are almost like a tripod of beauty and strength. And so if you're grounded, you're an immovable force, like a mountain. And so if you find your way to ground, it's going to help you tremendously in your life. And so how do you ground? Ultimately finding ways to build yourself up. And as it says, grounding is a practice that can help you pull away from flashbacks and unwanted memories and negative or challenging emotions, but it also can help you with your body itself. So grounding yourself and finding ways to actually get you to a place. Is this an important thing for me to think about? Is this an important thing for me to move forward and not be distracted and move forward? And grounding is extremely important for us in regard to Parkinson's, because if you find your way and you start to think too much in the way of an impulse control or other reasons, then ultimately you can't stay focused on yourself and what's going on. So grounding is extremely important to build yourself forward and knowing where you sit, where you stand in your life. And so I think it's super important to understand that. Next slide. So we're going to go a little bit further in, and this is a part of the talk that I gave not too long ago, but I think it's part of this. Understanding grounding, gratitude, and grit is understanding your mood processes and why are things happening to you and why you have certain ideas of things that are going on in your life, whether it be happiness or fear or apathy. And we'll talk about all of those today. We also will talk about the neuroscience of mood and what does that mean for us and what's happening inside our brains when we have a different change in mood. And we're going to explore a little bit more about the emotions and mood and talk about a little bit more about nutrition and neurotransmitters. We'll also talk about being fit and medications and therapy and lifestyle changes, which we've talked quite a bit about already. Next slide. So what's the definition of happiness? It's being happy. It's a feeling of overall joy. Sometimes you may not feel grumpy, and then if you just smile, you feel completely different in just a moment's time. They talk about the amount of muscles you use when you smile compared to frowning. It's a lot more muscle energy that you have to do when you frown. So let's use less energy and smile. That's my thought process. So what is it? It's a mental state of well-being characterized by positive emotions ranging from contentment to intense joy and good fortune. So smile on a regular basis. I think we talked about this in the past. I had this wonderful seminar I went to, and it talked about, it was just the title of the wonderful seminar was Happy. And they talked about what you can do for yourself moving forward, even if nobody's around. And I think I talked to some of you about the fact that when I go running this in the morning, I smile. No matter where I am, it's literally a little bit dark outside some days, and I'm smiling. And sometimes people see me, but it changes my whole affect for the rest of the day. And so, if you do see me in the middle of the morning, and I'm smiling, it's because I've learned from that talk that it really does make a difference in your emotional sense and all the kind of chemicals that are happening in there. It gets you started on the right foot. Next slide. Apathy. This is really, really important talk. And I do believe at some point we'll have a talk on each one of these separately, because that's a whole hour in itself. So what is apathy? So apathy is a lack of interest and enthusiasm or concern. It can cause indifference or uncertainty, or just not really wanting to do the things you used to do. And some of you may be experiencing this because it's super common in Parkinson's disease. And so some people may believe that you're depressed or unhappy, and it's not that at all. For some reason, when you have a dopamine deficiency, apathy can happen. And it ultimately is like, he used to always play golf all the time, or playing her having her roses be cut and make them beautiful and bloom. She used to love that, and she doesn't want to do that anymore. I think she's really sad right now. And ultimately, it has nothing to do with it. Actually has apathy. It's an apathetic moment. And if you understand it, it's much easier for yourself and also for the person that loves you, because they're so used to you being one way, and you may change over time and have actually apathy and not depression. And sometimes you're treated as having depression, unfortunately, by be given medications. But if you understand apathy and the things you can do to just get up and go, that's what the treatment of choice is. It's like, okay, I don't like to go playing golf. I don't really care. It's just literally the will to go do it, not necessarily that you're sad about it or you don't feel like you can do it anymore. And so always ask yourself, or the person that actually has Parkinson's or any other thought process of possible having depression, and saying, hey, maybe it is apathy. Maybe I should look at that more than actually being a mood change in regard to depression. Next slide. Anxiety. Okay, so we have a lot of different types of anxiety. We have a social anxiety. People have anxiety from just being afraid of maybe snakes, and that's a different type of anxiety. Other people have a panic disorder, where ultimately they go into a certain situation and it just tips them over in regards to the areas of the brain that create anxiety. It goes over to the place where they're no longer able to function with it. So anxiety and fear is a normal reaction to a known external source. Let's say you see a rat and it scares you. That's fear that is shown, okay, here's an external stimulus, I'm having fear for it. But then there's phobias that ultimately people can't tolerate having certain things around them, or be exposed to things because that's their phobia. And that's, again, something we have to walk through and say, okay, I have a phobia for this, and understand and recognize it. It really does help decrease the amount of anxiety if you understand it. That's why we're here today, to teach you the best we can so that you can feel good walking through life and saying, hey, maybe I should address that, because there are ways to actually help me through that. And then again, you can have a physical manifestation or similar. So ultimately, some people have a phobia for public speaking. And so I have a lot of patients that come in and they have, they can't talk in front of groups. They feel uncomfortable. And there's ways to actually help them through that, because if your heart starts to race and you start to sweat and your hands get sweaty, it's much harder to present something when you're feeling that way. And so there's actually ways to help you with that. So ultimately, looking at that possibility of what type of anxiety you have and walking through it with a professional, I think is really helpful. Next slide. Definition of depression. Okay, now we talked about apathy, right? Things that actually make you feel like, I don't feel like doing that anymore. I just don't have the desire to do it anymore, but I'm not sad about it. But some people can have a combination of both, or depression or apathy. And that's why we have to make sure we recognize what they are. And so what is definition of depression? Well, most of my patients, when they're feeling sad or feeling down, we actually do this wonderful survey that helps us kind of define what it is. And ultimately, of course, talking to each other. And so depressed mood, lack of interest. See where that says lack of interest or pleasure? Yes, that's part of depression, but you have to have 5 of the 9 to actually say, okay, I'm really, truly depressed. The next one is change in sleep, change in appetite or weight, low energy and fatigue. Some people have psychomotor changes, ultimately low of self-esteem, poor concern or concentration, or thoughts of sadness or death. And ultimately, that's why we have to kind of dive a little bit deeper into this. So it's really important during the conversation that you have with your doctor or someone that you feel and you trust, that if this is something that you're actually having pretty significant amounts of, and you actually have 5 or more of the 9, you definitely want to talk to somebody to see if it can help you through it and get you to a better place. Next slide. This is really important. This is very common in Parkinson's disease and a lot of different things: traumatic brain injury, strokes, multiple sclerosis, any type of brain changes. You can have something called pseudobulbar affect. Pseudobulbar affect is actually something that's so underdiagnosed, unfortunately. And what is it? And so you have mood congruency. Let me explain to you what I mean by that. When you see something happy and you start to laugh, that makes sense. It's congruent. You see something and you laugh about it, and that's how you normally would react to something that's funny. Or you see something that's sad and you go, I feel a little hard. It makes me feel a little sad, but you don't cry and go overboard with that person. What your normal way would be, which is, again, everybody's different. But what if you always cry over Hallmark commercials, and then you cry over Hallmark commercials? That's what you do. Okay, that's your emotional output. But what if you don't usually cry over Hallmark commercials, or something that somebody said, or something that you think about? You usually go, that makes me feel a little sad. But instead, you're like crying and crying, and like going, I am not really sad, but yet my body is showing that I'm super sad. Or you are in a totally different situation where you're at a funeral, and normally you're sad at that funeral, and you're laughing, and you're like, I don't know why I'm laughing. That's called pseudobulbar affect. It's very, very different from being depressed or overly happy. Okay. And what happens in the brain is you have this misconnection. So ultimately, when Parkinson's happens in a dopamine deficiency, or if you get a brain injury and it changes, it ultimately works around something called the limbic system. The limbic system is your emotional centers of the brain. And so when they cross-react or they interact wrong, you can have a feeling and then express it much, much more significantly. And so it's ultimately very much underdiagnosed and happens in a lot of different opportunities and possibilities. And so, and it can be really debilitating in a social situation, because I have people, and again, a wonderful man, just love him. I don't even know if he's on this call, but he's a fireman. And he first came to see me many, many years ago, and he was having this happen to him, to the place where he would not see any of his friends, which, again, wonderful camaraderie with firemen, and also always spending time with each other as time goes by. And they were all retired, but he felt uncomfortable going to see them, because he would even talk about even one instance of what would happen to them in the past, some great ideas, some great memories, and he'd start crying. He's like, I don't feel comfortable about being around anybody, because I don't know what's going to happen with my emotional state in front of them. And once we started a new medication, it's called Nutexta, and it's changed his life. Now he's back in with all his friends and able to go to coffee on a regular basis, because now he's able to address it in the right way. It's cough syrup and quinidine, which is a little bit of a medication for cardiac change, and it's very little. But dextromethorphan's cough syrup. But the beauty of it is we found this beautiful opportunity for people that do have pseudobulbar affect. And I just wanted you to know about that, because I think it's really important to know. Next slide. So we talked about neurotransmitters, norepinephrine, serotonin, and dopamine. So all of these are important and work in concert with each other to make sure that our mood ways are the best they can possibly be. And it helps with cognition as well. So serotonin, norepinephrine, and dopamine all work together to give you yourself, and understanding how your body is working chemically to actually be Mindy Bixby, okay? And so if you have a little bit less of this or a little bit more of that, you can have other symptoms that are created. So for instance, if you have low norepinephrine, you can have decreased alertness and concentration and energy. And if you have an opportunity to have a little bit less of norepinephrine and dopamine, they're cross-reacting and the attention may be a little bit harder for you. But if they're all working in concert with each other, things seem to be, the mood and cognition, cognitive function is working really, really well. And so that's why we look at all three of them when we're having, if somebody comes in and says, hey, I'm having difficulties with, aggression, or feel like I'm not really concentrating really well, or I have some anxiety. We look at all three of these things and say, okay, what do we need to do as a perfect possibility and moment for you to help you through this? So next slide. And so I want to talk a little bit more chronic stress on your brain. So this is a really important thing to understand, because as we walk through life, we get stressors, no matter what it is. Our mind, our bodies, our lifestyle experiences are always different, up, down, and around. And again, if we didn't have bad things, we wouldn't really appreciate good things, and vice versa. But when you have too much stress on your brain, you can create other things. And so this is a stress brain loop axis. Hypothalamus, pituitary, and adrenal axis all work to go around and control and release your cortisol levels. Cortisol level is your stress hormone. If you have too much of it, you can have stress, anxiety, and not doing so well, and actually can create some other issues, whether it be a decreased attention, perception, short-term memory, learning, and word finding. So stress can actually create havoc on your brain and your body. And so we're trying to find ways to find peace and grounding and gratitude to get you to a place where your stress levels can go down, and none of these things can be created on a chronic basis. And so the whole goal of this is actually trying to remodel your brain so that you actually don't have this chronic stress hormone always in your system and creating difficulties in your life. Next slide. So how do you decrease stress if you have it? So lovely Diana is going to talk a lot about this today, but the idea is actually finding ways that actually work for you. Every single person in this room today is going to be different with what works for you. So we have several opportunities to actually try and see if they work for you. Exercise, of course, is always on the top of the list, no matter if whether it be yoga or breath work or moving your body. And it's all about building yourself up and making yourself feel good. And ultimately it decreases cortisol levels significantly. Every clinical trial I've ever seen or watched or been a part of has been shown to lower the cortisol levels when you have exercise in your life. Meditation, visualization techniques are one way of actually decreasing stress. Socializing and sex, of course, is a good way of decreasing stress. Physical contact, spiritual practices, eating well, time management skills, so you're not stressed and trying to get to one more thing, and ultimately creating opportunities for boundaries as well, and saying, nope, I can't do that because I'm already enough in my life to actually say, okay, do I have time for myself? Always ask yourself that, because if you can stop that opportunity and go, okay, I gave myself a run today, and now let me go and see 16 patients, and I'm perfectly happy doing that, but I have to take care of myself at the same time so we can all have a balance. Sometimes journaling helps quite a bit, and I do that every single morning. Getting adequate rest, sleep is everything. We got to get you going and making sure you get some sleep. And then if you do need opportunity for medication because you don't have enough norepinephrine or serotonin, it's there for you, and you have to talk to your healthcare provider for that. Cognitive behavioral therapy we'll talk about in a moment. Music is fantastic if you can keep yourself moving. And of course, talking about the gratitude jar and the happiness jar. Next slide. Cognitive behavioral therapy, just want to put a shout out of what that is. It ultimately gives you an opportunity to talk. It's talk therapy. Everybody needs a therapist if you get a chance. Just get an opportunity to be able to say, okay, this is what's happening in my life. Let me have some objective opportunities for somebody to tell me that doesn't know me, to help me through some of the things I'm having difficulty with, or maybe just like getting a check-in and saying, okay, these are the things that are happening. And COVID has really been a big deal for a lot of people. And if you have an opportunity to talk about it, sometimes you can find goals and opportunities to get you out of some of those mind processes and those thought processes that get you in a better space. And so it can definitely improve self-control by developing cognitive behavioral skills that you may have not had without it. Next slide. So this is a multi-therapy approach for depression and anxiety. Some of you may not have that, but if you do, it's beautiful what you can do in regard to the brain and recovering from depression and anxiety. Through lifestyle changes in cognitive behavioral therapy, exercise, some people need antidepressants, but having an everyday practice that gets you to a place where you feel fulfilled and happy and at peace definitely is part of the brain recovery. It's beautiful what you can do with your brain just by getting to a place where you push yourself forward, and finding that gratitude and grounding and grit is everything. Next slide. So what is grit? So grit is perseverance and passion, pushes you through. So ultimately, every single person that is going through a chronic illness or a chronic emotional state have to have grit to push you through. And so it's wonderful to have the opportunity to have skill and tools to push you through. Every single one of my patients are pushing, and they have the most amazing grit. I wish I could bottle it and make us all have the opportunity to have this, but we all go through things and we find our way, and we have this, I talk about the metaphorical backpack that me and Diana have talked about in the past, about the things that happen to you throughout your life. You have, that backpack. Okay, I remember that. I remember what I did with that. That's how I got through that. And ultimately through life, you get more and more versed in understanding, having more grit to actually push yourself through and be successful. And it helps you push. I mean, all of us have had grit for whatever it may be. I mean, that's interesting how you look at yourself and you say, okay, I need to get through medical school, and I need to get through an opportunity to be able to get there when nobody in my family ever had medical school. They're like, why are you doing this? Just stop. One of my mom would say, like, Mom, you have to have grit to be able to push yourself through. And so she now understands why it was so important to me, because I'm here with you today. So grit's everything. Next slide. So Parkinson's disease and grit. You are incredible human beings with true grit. You came today to feel empowered, and everyone around you feels your tenacity. Every day pushing forward to building a new and improved you. And I'm so grateful to be a part of your life. Next slide. So with courage and compassion and connection, we have each other. And so if you find your grit today, you already did some of it. So you're educating yourself on Parkinson's disease and understanding what you need to move forward as an individual. As you know, every single person that has Parkinson's is a different individual. Every single person needs something different. And that's the beauty of individual human beings. But the nice thing about it is educating yourself on a regular basis, having a voice in your clinical visits. Please, 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 is this part of the grit moment. If you have some questions about what we talked about today, please talk to your doctor and allow yourself to have an opportunity to be the best possible person you possibly can be by moving forward with courage and compassion and connection. Next slide, please. So I love this quote. The secret of change is to focus all of your energy not on fighting the old, but on building the new. This is us new today. And so hopefully you feel that too. Next slide. So I would like to introduce Diana Christensen. She, again, Anissa did tell us a little bit more about her, but she has been a pivotal person in my life, and I'm really grateful for her. And she actually wrote a book not too long ago. Next slide, please. Which I was grateful to be a part of, ultimately going through the Golden Journey with her. It's a pilgrimage moving forward. It's a 45-day transformation. It's pretty amazing. And we've been friends for some time, and I think longer than this life. And so I'm grateful for her. Please welcome her. I'm so happy she's part of this talk today. Diana?
Thank you. Mindy, Dr. Bixby, I should say to everybody, did you want to open it up for questions first, or did you want me to jump in? I think, did you want to do questions first?
Oh, okay. What do you think, Anissa?
Yeah, we do have a couple if you want to address those, or if you think it would flow better to have Diana.
I'm sorry. Either way.
That's fine.
I would love Diana to have the last moment if I could.
So end up on the high note, on the relaxed note. So
please go ahead.
Well, and I think that will flow really nicely. So we have had a few questions and comments, and I'm going to go around more of a theme. First of all, I want to acknowledge that a lot of people joining us today have a lot of grit and a lot of resilience, and are going through some really, really, really challenging situations, whether they're the person with the diagnosis or the care partner. So some of these comments or questions are about, how do you vision a future with positivity when your spouse has Parkinson's and is going to be declining each year? It's difficult to hold positivity or tiny pleasures despite the stress. Another one was the vision, my bucket list. I had this vision for this bucket list of things that I wanted to accomplish. It's shrunk quite a bit because of Parkinson's. How do you accept a shrinking bucket list? And then just another one around the similar theme. And I'm just trying to do a theme in general, just to kind of encapsulate this a little. The hardest part is when people don't really get what you're going through internally, which adds to the negative feelings that arise. So, and I'll end it with somebody commenting, and I think this is a beautiful statement and kind of encompasses all of this, is experiencing moments of joy doesn't deny my feelings of grief and loss, which I think is really important to process those emotions, and to simultaneously hold but not clutch on to joy and sorrow. So can you talk about that experience? Like you mentioned it, you mentioned the role of all of these things, like identifying the things that we're grateful for, acknowledging the things that we might be challenging through journaling, through counseling. And there are some people that are dealing with some profound losses that aren't just related to Parkinson's. That's just one more layer of loss and pain. So I'm going to give you all of that because I think that's kind of the overall theme that I'm hearing from people, and that's a lot. So I'm sorry, but I think that when Diane, does her portion, I think that's going to add to what you're going to say.
For sure. So thank you so much. And so first of all, I want to tell you that I hear you. I am a part of your lives every day. And so I see it. And that's why it was so important for me to do this talk today and give you hopefully some tools that will give you an opportunity to move forward. And the beauty of what you do, whether you have Parkinson's or you are the one that loves someone with Parkinson's, it is very different of understanding of going, okay, I'm going to go from A to B to C to F to Z in my life. And these are the things I want to happen. And these are the things I want to make sure that I have my bucket list. And I understand that. And again, it does give it a little bit of a pause and going, how am I going to change? How am I going to get there if I'm in this moment right now, whether I have Parkinson's or my family has Parkinson's or my love of my life has Parkinson's? What do you do when you get to that space? Well, ultimately, everybody's going to be different because I'm not you. But walking in your shoes, I can never do. But I also can walk in some sort of your shoes. I couldn't fit in them, but I'm in there every day experiencing these things. And ultimately, if I could find a way to get you to a place where you have tools to actually allow yourself to go, hey, maybe that bucket list is not going to be the same bucket list, but it can be just as good, but in a different way. And so finding ways to actually say, okay, I wanted to go, I'm going to throw something out there. I wanted to go and see every single country in the world. And I want to do that before the age of such and such. And that is a goal and it's wonderful. But what if you can't get there, but if you can experience one or two of those things in what really beautiful life? Because boy, do I have goals. All of us do. But is there something where it's like, I just want to have one more day with my grandma. She's not with me anymore. But the days I had with her were so incredibly special. You have the opportunity to be with them right now. None of us know how long we're going to be here. None of us know what our lives are going to take us tomorrow. That's why I'm trying so hard to express the idea of being present right now. Yes, there's going to be things where like, darn it, I'm so angry because I really wanted this to happen in my life. But look around you and have an opportunity to say, hey, I can just tweak it just enough to still make it satisfying, but maybe it won't be exactly how I wrote it out for my life. And so I know that is something where it's hard some days, and I'm absolutely there with you, understanding the need for grit to push yourself some days, waking up and getting yourself through that day. But then on the end, you have this nice moment where you're ultimately going, I'm going to take a deep breath because they're still here with me. And all that beauty that they bring to my life, they're still here, whether it be you having it or your family having it standing next to you. It's one of those things where life is interesting, especially in this country. We do not talk about death. We do not talk about sickness until it happens to us. And we all are going to go someday. We just don't know what that's going to be. And so if we can find a way to cherish the moment of time where, oh, today I'm on right now. I know I'm going to have 2 hours on, or he's on right now. He got his medication. He's feeling good. He's talking to me. She's talking to me. I have this moment. Even the simple pleasures of life will make it more worth it. I promise, because the moment that we're no longer having that person in our life, whether it be because we went and, God forbid, and had a car accident, or I got sick, or you had something happen to you, that is in time a future thing. But I have to say something that's really important and profound for me is that I found a way to give myself 5. It's called the Big 5 for life. I read a book one day and it made all the difference in the world. And I wrote it on my wall before I walk out the door every day. And there's the 5 things of life that get me to that place every single day. And if I did those 5 things, even went somewhere towards it, if I was the past today, it was gone today, I knew I did the right thing because I was walking towards that moment. Whether I never got it, that's okay, because I was taking the steps towards it. The 5 things for life, just want to say them real quick. 1 is to build a very solid, ethical, kind human daughter. That's me. That's my 1. And I go out of my garage every day and go, okay, I'm going to do that today. And I come out and I look at it before I go to bed and I go, I did that. I gave her a hug. I love her. I'm taking care of her. 2, mind, body, spirit. Did I take care of my mind, body, spirit? Whether I did a gratitude journal or I had a moment of smiles, which I get every single day doing what I do. I'm so, so, so grateful. But again, whatever it is for you. The 3rd thing I talk about is taking care of my body. Do I do exercise? Do I take care of myself? The 4th is travel. I love to travel, whether it even just go down the street to San Diego. I love that opportunity to meet new people. Okay. And then the 5th thing is ultimately giving myself to be honest with myself every day. Am I honest with myself? Am I living a life that's best for me? And so if you can do something like that on a daily basis, it allows you to feel like it's not Groundhog Day. It allows you to feel like you're actually moving forward in this life in a beautiful way. And if you were to go, you're like, I did all the things I could possibly have done for that day. I know it's the big 5. It could be the big 3. It could be the big 2. But it really makes a difference. It did for me. And hopefully it does for you. But I understand some days are harder. And sometimes you have to have more grit. And some days you'll have more gratitude. And some days you will feel more grounded. It just depends. But the next day is a new day, a new beginning, and an opportunity for you. And I hope you can see it that way.
That was fantastic. And I'll make one statement that just came in, and then I think it's a perfect transition to Diana. From Corey, we can notice and enjoy tiny pleasures. I love it when I can catch the sunrise, which only lasts about 10 to 15 minutes of beauty where I live, but the rest of the day is beautiful too. And I have to remind myself to notice it. So I love that. I love those 5 things. And even if it's 3 things. And the other thing, you mentioned early on was acknowledging your accomplishments. And even if it's just 1 small thing or 2 small things that you did, and they're really basic, but it's still an accomplishment, that's a positive thing to do for yourself. So. All right. So Diana, we would love to hear from you now.
Yay. Well, I love that the questions came before I got a chance to speak, because I want to start with a story of my father. The book that Mindy made reference to was dedicated to my father. And it's this place where Mindy and I came together and had this lovely understanding, because my father had Huntington's disease. And Mindy, of course, amazing Dr. Bixby, studied that in her doctoral, and she understood so much about this disease and about my father's life. My father passed 2 years ago, and he was an enigma in the world of neurological disease, because my dad lived to be 81. And he had this amazing ability to continue to reboot. And his mantra was, I'm a lucky man. My whole life, I heard him say this, but especially even towards the end of his life, when to know a bit about Huntington's, like, and I understand so much about Parkinson's because of it as well, as his body started to change. And when he could no longer drive, then he got all excited about getting this bicycle and where he was going to ride his bicycle and his backpack and going to the grocery store. And when he could no longer use a bicycle, he got excited about souping up his walker. And so my dad had this amazing ability to, rather than identify with his disease, it's what Mindy was sharing with you, the top 5 things. I watched him identify with what he loved and what he could still do and what he was passionate about. And so because of that, he was never short of things that he woke up in the morning interested in engaging in. And towards the end, my dad was in and out of the hospital, which he hadn't been up until the very last 2 years of his life. And the doctors, a lot of them weren't familiar with Huntington's or really met someone with Huntington's disease, but what they knew from the medical journals is there's a lot of depression. And my dad just had none of the things. And so they would talk to my mom and I'd be like, tell us about your father. Like, how is it that he is this way? And if I could share with anyone what I wanted to share with you today, is it was his perspective on life. And just what Mindy said, like his ability to continually like refocus on what can I do today? What makes me happy today? What is that thing? And the bucket list changed, right? But there were still things that he was so passionate about, and he continued to find those things. So my gift to all of you is 3 practices. So Dr. Bixby did this great job of talking about things like gratitude and grit, and she has all this amazing research and pictures of your brain. But I think, when I think about my father or about our lives, our quality of life, it's like, how do I be that person that says, I'm a lucky man? How do I get to be that person that in the face of my body changing, I can still say, but I can do this, and I'm excited about that. And I think it's practices. And so I've really, my 30 years of being in the world of psychology and different health practices, meditation, yoga, breath practices, I would say that Mindy and I have this commonality of saying, like, me as a person, I am a physical body, I am an energetic body, and I am an emotional body. And one can never be separated from those. So if emotionally I'm depressed, it affects my energy and that affects my health. And so anytime that we're able to do little practices that affect one, it's always going to be able to affect us as a whole person. And so I'm going to give you 2 practices that I would give to my clientele over the years that I asked them to do, like in the morning, and be faithful and do this every morning. I asked Mindy to do it, and she has a lot of grit, so she did it, and it changes your life. I will tell you, I've worked with hundreds of people, and these simple things I'm giving you today will change your life. And I want to kind of share this as well. Something else that Mindy and I have in common is that we oftentimes talk about the brain and neural pathways, and we both understand how important it is that we train the brain to go the direction we want it to go. So we get better and better at gratitude, and the more we practice it, the more we are like that grateful person in whatever's showing up in life. But there's also this second brain that Dr. Bixby talks about, gut health. And the second brain, your gut, is always influencing your first brain. So if I can help each of you get better at feeling grateful, at naturally going to this place where I'm feeling grateful right now, it's going to affect what the messaging that you're saying in your brain. One is always affecting the other. So I want to give you these 2 practices, and then I want to also give you a third practice that is a practice that I want you to like pill in your pocket. I want you to pull out as needed. I know I don't have a lot of time left, so I just decided this, and I hope it's okay with our team here, but I would like to gift all of you with like a little video that I make for just those of you that came today of what I'm about to say. I'm just going to make a 5-minute video so you have it and you can practice it with me whenever you feel like it. The first practice is breath. Of all the things I can give you that will affect your physical health, breath is number one. And what we don't realize is 80% of the population, I actually think is higher, is breathing incorrectly, and it's attributing to poor health rather than helping you feel better. And also it affects your energy, whether you feel like you've got the energy you need, whether you're able to de-escalate down from being in an anxious state. All of that is affected by your breath. It affects your nervous system instantly. More effective than any pill you can ingest is your breath practice. And the breath practice is going to also create this space and this opening where I can help each of you become better at practicing gratitude. Because as Mindy, I'm sorry, I just want to say Dr. Bixby was talking about gratitude, it's like that whole outlier thing, like 1,000 hours. No, they say it takes 10,000 hours to become an expert at something. And I always ask my clients, so what do you want to become good at? You know, playing music, running marathons, whatever. I think if we all really sat down in this short, precious life we have, what do you want to become good at? And I think we can also say, I want to be like the best lover of life and people. I want to be happy. And gratitude is the bridge to happiness always. And so, so this breath is going to help us create a space where we can find ourselves in this place where we can really choose feeling in our gut and choosing in our mind gratitude thoughts. And if we do that every day, every day, every day, we'll become experts at it. We'll become better at it. And we can all join my dad in that beautiful place of feeling lucky and blessed and choosing that. I always like to tell this little story. I'm like looking at my watch here really quick. Okay, I'm running out of time. There's a Harvard professor, Sean Aker, that I refer to in my book, and he's a happiness professor, and that's his whole life is dedicated to research on happiness. And he goes to this corporation to teach happiness. And during the lunch break, he's outside on the lunch break, and he's just enjoying his time outside on this break. And the first person that comes out, this gentleman, kind of sounds like a joke. He comes outside and he's like, "Oh my God, it's so hot out today." And then he goes back in. And Sean's still on his break outside. And the second man walks out and he looks around and he said, "God, what a gorgeous day it is outside. It's beautiful." This is a story of our lives. And there's 100 times throughout the day, maybe even more, when we're making that decision between the reality is the same. It is hot and it's also beautiful. And so how do we direct our mind to go down that pathway to focusing on what's beautiful rather than spending this attention on something that in the end doesn't serve us as much as this one? So very quickly, the breath practice I want to teach you is simple. It is to seal your mouth and to only breathe through your nose. That is the number one health tip. We're oftentimes breathing shallow in our chest region. So if you could think of my hand moves up the spine and towards the top of the head and then moves back down the spine, my hand moving up the spine is an inhale stretch. And the breath down the spine is an exhale. And as you just begin, let's do this with me. Inhale and exhale. Breathe up the spine and down the spine. And if you just sat here with me and did 10 breaths, just like that, at first they're kind of shorter, but if you do it every day, my teacher said, practice, 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 and all is coming, you will get better at breathing up and lengthening that breath down. And what happens at the end of the 10 breaths, you not only feel like you just recharge, like you plugged in your personal iPad for your body and your energy and your thinking self, but you also at the very same time help yourself like calm down. So we're creating more energy and we're calming down at the same time. So your morning practice is going to be to put your hands over your heart. This is something that Dr. Bixby does every morning. and to take 10 long breaths, as long as you can, soft shoulders, sitting up straight, jaw nice and soft. And after you do your 10th breath, I want you to use your hand and go through 5 things you're grateful for. I'm always grateful for my mom. I'm always grateful for my dad, even though he's not with me anymore. I'm still so grateful for him. And then I go through, like, I could just spend time with you today. Like, Dr. Bixby, this is like a great honor for me to be here with you today. That's going to be one of my 5. And then as we go through and we get to the pinky is always something new. And what that does, it allows your brain to throughout the day be scanning for that new thing. And all of a sudden, I'll be having a tea with Dr. Bixby, and I'm going to be like, oh, that's my new thing tomorrow. I got to have tea with you. I don't get to do that all the time. And we get better and better at like going through our lives. And I have to tell you, in my hardest times, some of the hardest times in my life, I have gotten so good at this. I'm on autopilot, and I automatically, in my subconscious, in my feelings, I go to what, as we said, we can ground ourselves in. I have love in my life. I have, and when I look at the things that might be faltering in my health, the tremors are increasing, whatever, I can go to. But I am still able to do this walk every day around the block. And I get to see these trees. And in the book, I talk about nature's medicine. Like, we start to find these things. And I love this tree when it's in bloom and it's purple. And all of a sudden, our life is filled with these amazing things. So those are the 2 things I'd like you to do every morning, and just challenge me to, like, really, that can change my life. Challenge me. Do it for 30 days. Do it for 30 days and see if this does not change your life if you do a breath practice and a gratitude practice every day for 30 days. The last thing, and then I know we need to stop here, but one of my practices is called Flip It. And Flip It is when you're able to observe in your day something, you're going down a negative path. You're starting to get upset about something that's changed in your physical health. Somebody said something to you that hurt your feelings, it really bugged you. And then it's gonna be like eating potato chips. You're gonna think about it all day. You're gonna be depressed about it all day. You catch it. It's a catch and a flip. You catch that and you're like, wait a second, am I gonna let this ruin my day? Am I really gonna let this ruin my day? And you're like, I don't want it to. So you flip it. So we're gonna turn it upside down, and you're gonna go to a grounding, one thing you're grateful for, and ground yourself in it. That is your catch and flip to do throughout the day, your practice. I am thrilled that I got to share these 3 practices with you, and I'm going to make you a short little video where we're just going to do this together, and you'll be able to be reminded of what the breath is like and to use it in how you show up physically, emotionally, and energetically for your, as this is I want to finish with one of my favorite quotes by the poet Mary Oliver. It was from a poem called The Summer's Day. And at the very end of the poem, she ends with one question. And I ask all of you this question. She said, tell me, what is it you plan to do with your one wild, precious life? Thank you.
Wow, I love that so much. What a great ending to this presentation. And you guys have been getting lots of love in the chat. It's been a wonderful, wonderful and helpful presentation, and I'm going to do your practice for 30 days. I think we all could benefit from that. I love the flip analogy, Manny said. I love the flip analogy, that easy breath work. These are little tiny things that we can add to our day that can really change our perspective. So thanks to Dr. Bixby and to Diana for sharing this wonderful presentation and wisdom. And now we have a way of showing gratitude as collectively as PMD Alliance, and that is our thanks and wave of gratitude to our 2 lovely speakers today, Dr. Bixby and Diana. So I'm going to invite everyone to give that love to both of them and thank them so much through our wave of gratitude. Thank you everyone for staying with us today and joining in and being a part of this. I hope you have a lovely rest of your day.
Thank you.
Bye.